So the Quantum First study was an international multi-center trial that investigated the use of Quizartinib, a second-generation type 2 inhibitor of FLT3, in combination with chemotherapy, induction, consolidation, and prolonged maintenance for up to 144 weeks. In the Quantum First study that accrued patients up to the age of 75 years old with a FLT3-ITD, we showed a survival benefit from the addition of Quizartinib compared with placebo for the entire group. Now, one of the questions that comes up from this analysis is what is the safety, especially when we look at a prolonged maintenance period, and what is the safety of the agent when you look at the older patients versus the younger patients? I will remind you that we actually have no study available that looks at, in a randomized fashion, the safety of adding a FLT3 inhibitor to older patients with acute myeloid leukemia who are receiving intensive chemotherapy. So this is one of the first large data sets that will allow us to do that. What we found was that in terms of the prolonged consolidation, the time that patients were on the continuation phase was 1.3 years in both the Quizartinib and the placebo arm. So similar amount of time out of the 144 weeks that they could take it. We did find, however, though, that during the continuation, there was a higher incidence of infections, a higher incidence of cytopenias during the continuation phase. However, the incidence of febrile neutropenia, I should say, was actually no different during continuation between the Quizartinib and the placebo-treated patients. So although a higher incidence of cytopenias during continuation with Quizartinib, it did not translate into a higher incidence of febrile neutropenia. However, during continuation, there were more discontinuations, more treatment interruptions, and dose reductions with Quizartinib versus placebo during the continuation phase. Now, the other important part of this is the older patient population. When we look at the early mortality at day 30 and day 60, at both time points, it was higher with Quizartinib than with placebo. So, for example, at 30 days, it was 6% with Quizartinib and 3% with placebo. So we investigated how age affected the toxicity of this agent in addition to chemotherapy. And what we found is that older patients had more treatment emergent events that were related to infection and GI disorders, as well as QT prolongation. However, there was no mortality during the continuation related to the toxicity of the Quizartinib compared to placebo, no difference between the two. So what I believe that this safety data shows is that when you add a myelosuppressive drug like Quizartinib to induction and consolidation chemotherapy, you are going to see more infections and more cytopenias with the addition in any phase of the study, especially during continuation. However, the rate of QT prolongation in the entire study was 2.3% grade 3 QT prolongation with Quizartinib versus 0.7% with placebo. And actually, there was no grade 3 QT prolongation during continuation phase of the study. And so I do believe that the safety profile here does support the long-term use of Quizartinib for up to 144 weeks during continuation. Of course, the other side of that coin is the quality of life of our patients on that continuation therapy, and that data is also being presented at ASH with patient-reported outcomes. And the second is the benefit of up to almost 3 years of continuation therapy. And we are analyzing that data, especially in regards to the measurement of measurable residual disease. Now, on the other hand, in older patients, there was clearly higher induction mortality in the older patients compared to the younger patients, and it was higher with Quizartinib than with placebo. And so I think that the Quantum First study does support the use of Quizartinib in FLT3-ITD-mutated patients up to the age of 75. However, I still think it's a challenge for physicians to select the optimal therapeutic intervention for the individual older patient with a FLT3-ITD-mutated AML.